So I came from Boston University before this. I was a assistant professor there, and so for a variety of reasons we decided to look other places, see what was out there, and checked out a variety of schools. And what we liked about USF, there was a lot of action going on. At the time that I was moving, Jackson Labs, which is a big facility for providing research animals, various mutant mice and so forth. They're again based in Maine. They're looking for an outpost place to put their stuff elsewhere in the country. They decided on Tampa. So there was a lot of action going on from industrial companies moving to this area and taking a place in Florida. Of all the places they picked this area. So if you look around nowadays in academia, you'll find that because of budget crunches and so forth, most departments are just sort of treading water, trying to stay afloat, and they're hiring, typically not hiring or expanding, I should say, but typically somebody will leave or retire, and they're sort of replacements hires. So they just, if somebody leaves, retires, they bring in somebody new to take over that position, but they're not really expanding or anything like that. But clearly USF was expanding, so I like that. So that's one of the reasons. Second reason was that Boston University, where I was at, is a high-ranked program in biomedical engineering, and since this is a new program, there was less inertia in the system. So I could have a much larger impact on this particular programming and shaping it and sculpting it into the way I think the program should be, and sort of eliminate some of the things that were not so good about the program where I was, even though it was a top 5 BME program in the nation, because there's just a lot of stuff in the system and nobody has the willpower to change it. And Bob Frasino is also on board with me. He's also a part of the BME leadership, and they're doing things that I really like. So it just seemed like there was a lot of movement happening here, and since I've come here, it's sort of proven to be so. So my research is in visual neuroscience, and what that means is I take, since I'm a biomedical engineer by practice, I take engineering tools, principles, and apply them to the visual system, try to understand how it works, both from a basic science perspective, trying to understand how we and other animals see, and then trying to use that information to develop diagnostic tests or devices that can determine when somebody has a deficit that's arising or repairing a blindness or pending blindness of a condition that they might have. So, for example, projects that are going on right now are sort of span the range from lower invertebrates to vertebrates, and I take that approach because I'm interested in how different animals see, and so I gravitated to working with rats, and I sort of stuck with rats. So now I use rats for basic research, trying to understand how we and other animals see, as well as use them for glaucoma research. And then I contrast the research with rats with research on horseshoe crabs. And then whatever is different between those two animals, and particularly with regards to rats, must be important for higher level vision related to glaucoma, since horseshoe crabs can't possibly get glaucoma and stuff like that because their eyes are so different. So that's kind of the tack that the research takes. And so this is how a typical experiment would go, and try and understand that. So in this case, where we're doing recordings from a rat, is lying here off screen, and the animal is looking at a screen. Well, actually, it's got 2 eyes, so it's looking everywhere here. But we're going to record from one cell, and that cell happens to be looking towards the screen. and you'll hear a clicking sound. And that clicking sound are the individual discharges of a cell as it's sending its that signal to the brain. And as I play this video, as you're looking at this, since this is a mammal, and there's a cell type within your eye that's going to be responding pretty much the same way as this cell is. There are other cell types in your eye that we're not recording from, or that the rat doesn't even possess. But this kind of one your eyes would have. Alright, so let's play it. So what you can hear by that increased activity, that sound, is when you stimulate a cell. So it sounds like somewhere here, right? And now you really know. The cell's looking roughly there in space. Now it's constantly active because there's light around, right? But it's only when you put that stimulus in the right spot. And you'll notice that this cell likes a dark stimulus, something that's darker than the background. There are other cells in your eye that would not like that. They would actually be excited by a white stimulus. So as engineers, we'll use sinusoidal gratings because we're going to do Fourier analysis and all that sort of stuff on it. And that's the actual electrical signal that's being sent to the brain. And so we can play different types of stimuli, record that activity, do a cross correlation and get like the linear aspects or some more complex analysis to get out the nonlinear components and try to understand what is causing each one of those spikes to happen. What process. So that's just sort of one kind of experiment that we do. And I got interested in this because clinicians, they don't have the tools because they're not going to go in and record from single cells. You can't do it in a human. So they don't really know what's happening on an individual cell basis. And so we use the rat models to try and look at what's happening on these cells on an individual basis by recording from them and comparing how they respond under normal and abnormal conditions. The way that it's affecting it is a variety of ways, at least that I've done so far. So some of the ways are to make, say, for example, students aware of this area of research that one can pursue, neuroscience. There's really not a lot of sensory, visual neuroscience going on here. There's a lot at sort of the cortical level with Alzheimer's and so forth over at the med school. But there's not as much from a sensory perception here. There's some at the psychology department, a couple guys doing some neuroscience work there, but not much. So now they've brought on Bob Procina. He does pretty much the same sort of work I do, only with auditory system, and they have myself. So we're starting to build a nucleus of people here. And going forward, we're going to want to recruit people to here. And so part of the mission is to make people aware of this field, that you can do this research. So I'll go out, I'll talk to students like you. I've gone out to high schools and middle schools, telling them about this research, introducing them to neuroscience and neural engineering, applying engineering principles, promoting neuroscience and biomedical engineering outside to the Tampa area, to high school students. So this summer, I'm working with a particular high school and getting them to offer up whatever students are interested to come here and work with faculty members in their research during the summer voluntarily as part of their, we call it Bright Futures, I think it is, scholarships, where they have to do so many hours of community work or volunteer work. So rather than just sort of using it for anything, they can put it towards this purpose, and as a result, they get the benefit of seeing what's going on in the lab. Professors get the benefit of having some research or some tasks that anybody sort of could do. You can give it to them, and then the graduate students can sort of devote their time to more specialized tasks. And then, USF can win because now the students see what's going on here. They may get excited by what's going on here, and ultimately may choose to hopefully come here, and so forth. So that's another thing I'm doing so far. And then of course there's the research itself. I'm collaborating with people over at the ophthalmology department, particularly with regard to the clinical aspects. There's a project that's really not mine that he's working on. I'm sort of helping him with. Then there's this device that I'm trying to build, sort of with regard to the glaucoma control, that we're working with him to be ultimately be able to test it on patients. Right now we're just working with that, testing it on rats. So that's other areas where the impact is felt outside of my lab and everything. I just enjoy it. I mean, you can tell from, or I can tell when I do the experiments and I bring a student in who, for example, has an aptitude for neuroscience and neurophysiology. Because, I mean, even to this day, and I've been doing it for probably 10, 15 years now, that sound, when you heard the clicking sound, you go, to get to that point, we'll have, in the case of the rat, for example, we'll get in the morning, we'll have to prepare it. So there's a lot of surgical techniques to have to get to have the animal on that, to get to that point, because we're monitoring all these vital signs to make sure the animal is physiologically stable and healthy. And after all of that, you kind of put the electrode in, you get the spikes, and you can start collecting data. There's something intoxicating about that. And so when I bring in a student in the lab and I'm training them on it, and I expose them to it, you can, if they've gone through that, you get to that point and they're excited, and they're hearing the spikes, and they can't wait to get more data. I mean, I know that the student is cut out for physiology. Then there's other students, you'll get to that point and they're like, okay, yeah, so what? What's the big deal? And clearly they're not cut out for physiology. Because again, few people actually have this training or skills. I don't know how many would actually really want it, but once you acquire it, when you get that spike in activity happening and you're sort of basically tapping in and listening to these cells as they're doing what they think is their normal job, just kind of processing life. You can sort of sit in, listen in, get the activity, sort of tweak it a little with your stimulus, see how it affects it. I mean, you can actually manipulate it by changing the stimulus. It's not just some ongoing activity, right? Whatever you decide, you walk in front of it, you can hear it sort of modulate the activity. That is what excites me. Getting to that point, trying to understand how the system works. And if you don't have it, you'll never be good at this.